Hi, this is Town of Islip Supervisor Angie Carpenter, welcoming you to another edition of Supervisor Spotlight. And today, the focus of what we're going to talk about is Mental Health Awareness Month. May is Mental Health Awareness Month. Hopefully, this will be running longer than that because we hope to share some information because the issue and the problems of mental health that we're experiencing are not going to go away. And so today, I'm delighted to be joined by David Vizzini, who is the Senior Director of Residential Services for Outreach, and Catherine Dickin, who is a social worker at Good Samaritan Hospital. So welcome to both of you. Thank you so much for making the time to be here. And hopefully, at the end of what we're going through here today will be a positive experience for those who are listening and watching. You know, we in the town, in the county of Suffolk, there are many, many opportunities for help. And we will be posting those agencies and that information on as we're talking today. But also, too, you can go to the town's website, islipny.gov, and get all of that information. So, David, I want to start with you. Certainly the pandemic that we've been through these last 2 years, and unfortunately now it seems to be spiking again, has wrought havoc in a number of areas, but certainly in people's mental health. And from what we're hearing and seeing, women have been more adversely impacted and young people. So from your, part of the world, what are you seeing?
Well, first off, Angie, thank you for having us on. We really appreciate it. So at Outreach, we've seen a large increase. I mean, obviously, if you go back to 2020 when we had the shutdown, it was difficult to get services. People were sheltering in place, and not a lot of community-based things were available. Fast forwarding to today, even though the things are open, and as the virus is spreading again at a high rate, good news is hospitalizations are still down, right? So at least we have that.
Right.
But I think what we've seen is, again, that people have really not fully adapted back or have accepted the new normal. And I think that where we've seen increases, definitely with women and young women and adolescent girls. We run residential programs at Outreach in New York City and Long Island, and we actually have more girl admissions into residential and to our outpatient programs than ever before over the last 2 years. Wow. We're seeing a spike. We're also seeing a spike in people, progressing in prescription drug use because of access, and then also we're seeing the uptick, obviously, in the marijuana usage as well, and people are turning to drugs for coping because they don't know how to deal with the stressors that they're facing. Focusing specifically on adolescents, Outreach specializes in outpatient residential care for adolescents on Long Island, has many programs in the town. Mm-hmm. And one of the things that we really noticed is that adolescents are really struggling with coping socially. They just don't know how to socialize in healthy ways in person, and then how they socialize, which I know is a topic for later about, through social media, is seeming to be very inappropriate. And then so we have this big
let's stop right there.
Sure.
Because I think that, and Catherine, I'm sure that you can attest to that also, when you say social media and young people especially not having social skills, I can't tell you how many times I've been in a restaurant and you see a family sitting there, mom and dad and the 2 kids, and everybody is sitting there with their phone. Are they texting each other?
Sometimes.
I mean, they're not communicating even in a setting like that over a meal. And it seems from what we've seen and heard that social media, for all of its positives, has really wreaked havoc with society in many, many ways, with an increase in bullying. I don't know if in your world as a social worker, Catherine, you're seeing that.
Absolutely. Yeah.
So,
yeah.
I mean, do you have people coming into the hospital that you're working with along those lines?
Yes. So, in the emergency department, we do manage a lot of crisis intervention. And Definitely across the board, we are seeing an impact on a lot of individuals regarding social media, or just the phone use in general. They might not even necessarily be on a social media website, but, there's a lot of instant gratification that's involved in how we access any material that we need now, or, where we're getting our resources from. So, like you were saying, probably the largest percentage of that we're seeing right is with the adolescent age group. The adults are struggling with the social media as well, but definitely the adolescents who have grown to be more dependent on it are having almost crisis moments when it's not available.
Yeah. It's interesting, we have an opioid and drug abuse task force in the town of Islip, chaired by Mary Ann Pfeiffer from Youth Enrichment Services and Drew Scott, formerly of News 12, who lost a granddaughter to drug overdose. But one of the strategies that they were looking at employing, especially for this month, in raising awareness, is getting young people to sign a pledge to not engage in any social media for a week. And I just don't know how successful, we're going to be, because that truly is a challenge for some of these young people. And, I go back to one of your first words, David, when you said social skills and not having, those situations. Young people especially don't seem to be comfortable, in a
Correct.
social situation. And that really doesn't speak well for our future, I don't think.
Well, I think what happens too is that we have to understand that the world has changed, you know what I mean? And, I'm raising young kids. I have a 12-year-old, 11-year-old, and a 9-year-old.
Oh,
right?
12, that's a tough age.
You also.
And I think, thank you. And I think, one of the things that me and my wife really had to understand is that there are a tremendous amount of social pressures for kids. Like, 2 out of my 3 kids have phones, so the youngest doesn't, you know what I mean? And that was a lot of pressure by them and society for those age groups to have phones. But one of the things that we do is that they don't have the same level of access that their friends do for social media, and we get plenty of grief about that.
Oh, I'm certainly.
So, but it's really about, the parents and the young people understanding how to manage it appropriately. Because if you take the approach with young people, the answer is no, then they're just going to find ways to do it, and they're going to keep it from you. If you just give them the whole boat, they don't have the skills, they don't have the self-awareness in order to manage themselves. So really what we need to find and really help is parents with young people, help them manage their children's use of socialization through social media, but also promote interpersonal skills and communication with their peers in person, because I think that we have to manage both of those things for children to really develop into the healthy human beings that they're going to be. But again, I do think that social media, technology is such a big part of our life. I mean, look at us here now.
Yep,
Right?
yep.
So I think we have to embrace
Exactly.
that.
Listening to what you said about parents, I have 2 grandchildren. One granddaughter who's 20 and a grandson who's 8. And I know with the 8-year-old in particular, his parents just recently told me how they've sort of restricted his use of electronic media in any way, shape, or form, whether it's, his iPad or whatever. He's limited to a certain amount of time that he can use it over a given day. And so we'll go into that a little bit more. We're going to take a little break here on Supervisor Spotlight. Thank you so much again, David and Catherine, for being with us, and we'll be right back.
You are watching ITV, Channel 18, Islip Television.
Hi, this is Angie Carpenter, Town of Islip Supervisor, here today talking about mental health issues as May is Mental Health Awareness Month. And with us, we have David Vizzini of Outreach and Catherine Dickin from Good Samaritan Hospital, who's a social worker and deals with the public, seeing them when they come in through the emergency department. I think it's important to note at Good Sam, you have a segregated pediatric emergency
We
department.
do.
And with the modernization program that's going to be happening at Good Sam, that's an exciting 300,000 square foot addition, but they're expanding the ER and making every, single person is going to have more separate space
Correct.
than is there now. So that'll
Yeah.
make everyone's life a little easier, and hopefully, not hopefully, but I know will produce more positive outcome for those that come to the facility.
I think so.
Yeah, but, so we're digressing, but back to the issue of mental health and how it was exacerbated so by COVID, especially with women and young people. And we talked a little bit about social media, but I also, there's gotta be warning signs. We hear about the horrific things that happen, like we just experienced with the shooting at the supermarket in Buffalo. God, rest the souls of those people that, lost their lives. But there were warning signs, and what are some of those warning signs? What do you see in the ER when someone's coming in that maybe says to you, uh-oh, this person really needs help?
Yeah, there are definitely warning signs, and very often it's not just things that we're observing in somebody who's coming in with a crisis, but reports from family members or people who are close to them, which kind of gets back a little bit to the increased difficulty of the social connections, because sometimes it could be harder to recognize behavior changes in a loved one or a friend when you're solely communicating or mostly communicating through text message,
yeah, gotcha.
or
Mhm.
social media, or
Mhm.
there is a little bit of a piece that we are missing now, that really gets to know somebody and their personality, and so it can be a little harder to identify those kinds of things. But things that we do look for are that we observe are obviously behavior changes for somebody that, maybe you typically know them to be a very relaxed or calm kind of person, or is able to cope, and, maybe now they're more agitated, maybe they're a little bit more belligerent, something's kind of off with them. And then that goes along with maybe a personality change. So, and that could go either way. So for somebody that you think is generally a positive person or very outgoing or very chatty is now suddenly withdrawing or isolating themselves or not talking as much. And then on the opposite side, maybe you do know somebody who does kind of struggle a little bit with being positive. Maybe they have a little depression that they have shared. And then all of a sudden, this light switch goes on and they're elated, they're happier. That could be a warning sign too, sometimes, that they've sort of made a decision.
So if I'm hearing you right, drastic changes in what you know a person to be should be a wake-up call, a warning sign. And I'm sure that, from a family perspective, it's probably difficult sometimes to accept the fact that maybe the person is a little off.
Yes.
So, David, you must deal with families all the time. I mean, people don't just come into the facility, sign themselves in, and then you don't hear, deal with families. So what are some of the things that you can, share with us that would help?
Sure. So, as you can imagine, as a parent, it is very difficult to look at your child and say, there's something wrong. You know what I mean? And the first thing parents do is they blame themselves.
Yeah.
And they want, you want your child to be perfect.
Yep.
You want everything in their life to be
Well,
perfect.
they're
You want it
healthy.
always to be better than it was for you, you know?
Something that I remind parents that I work with is that, you know, growing up is a process, you know what I mean? And no one grows up at the same rate. And I think that that's very, very important, you know? And parents tend to compare their children to their other children. They compare the second child to the first and the third to
Right.
the second and so on
Yeah.
and so forth. And it makes it difficult for them to really see their children as individuals, you know, stand alone. And that's normal.
Mhm.
And again, from a parenting standpoint, that's normal. From an adolescent development standpoint, that's normal. I think what's important is that you gotta advocate for your kids, and you can't be afraid to get them help and services. Schools have a ton of mental health services, starting in elementary, that is paid for by the school and paid for by the state.
Do you find, and I think I've seen this, that because of COVID, there's more of an acceptance of the utilization of mental health services and more available, especially through the schools,
Absolutely.
that they're adding counselors where they might not have had them before?
Yes, I mean, a lot of the federal funding that's come down through the, you know, through the state, to the county,
Mhm.
through the town, you know,
Right.
saying has been very, very helpful with regards to school districts, hospitals, other institutions, you know what I mean, in providing mental health services to all age groups, you know, the elderly, adults, young adults, adolescents, and that's been crucial, you know, to combat all of the mental health related issues that have come up, you know, because of COVID, but there were tons of issues before COVID.
Oh, sure.
So, you know, I just think that, you know,
Yeah,
but
yeah,
I think COVID has allowed us to really put the spotlight on it, because I think that one of the things that's a real powerful message that a lot of people in the field of mental health services talk about is that what the world felt for a year or two, you know what I mean, is still feeling on some level, is
Mhm.
what people who suffer with mental illness feel all the time
Yeah.
for
Ah,
decades.
That's really a good way to look at it, that sense of isolation and,
Sure.
you know, I think as human beings, we tend to think that what we're going through is unique to us, nobody else had to deal with this, et cetera.
Yes. Yeah, so it's very, very powerful. I think that overall, the main thing is to try to be self-aware and try to be aware of your children, your loved ones, because that sense of awareness and just talking about it, just having open communication, non-judgmental, hearing people out is really, really important. You know what I mean? And offering to help when they're ready. You know what I mean? Just
Right.
be supportive. Do not be judgmental. Don't make it about you. It's about them. Help them help themselves. And that's really the key. And believe it, the support is the biggest thing.
And the communication, so you said having those conversations,
Mhm.
and again, the social media comes into it, because if they're sitting there with their, you know, phones or their iPads or whatever, you know, texting or instant messaging their friends, you know, they're not likely to have that conversation. So, you know, a parent or a loved one has to be able to say, hey, you know, put it down, let's really talk, let's really.
And one of the biggest obstacles of what it comes across is that because of social media and because there's the wide access of people that you can communicate with, you're not communicating with people that are seeing you in person or in your everyday life.
Okay, so again, communication, and we're going to come back after another little break. I know that Catherine said it too, and David certainly, so we will be back on Supervisor Spotlight. Okay, so let me.
You are watching ITV, Channel 18, Islip Television.
Welcome back to Supervisor Spotlight. I'm Angie Carpenter, Town of Islip Supervisor, and we're delighted to be here today with David Vizzini of Outreach and Catherine Dickin from Good Samaritan Hospital, who's a social worker there, talking about some of the mental health issues that we're facing as May is Mental Health Awareness Month. And when we left to take a break, we started talking about communication and having those conversations. And during the break, Catherine was sharing some of those strategies for those conversations that don't always happen when you decided as a parent or a loved one that you're going to have that conversation, let's sit down and talk. It can happen when it happens, and you've got to be open to it.
Right. Right. Yeah, so, lots of times as parents, we just have this urge, even if we think that something is off, or if we just want to learn a little bit more about what our kids might be going through, we have an urge to sort of prompt them and say, how was your day, or how was school, or and you'll find that you get kind of a very bland or guarded answer. It was fine, nothing happened, nothing exciting happened, So in prompting kids, especially the adolescent age group, and you're trying to get them to open up on your own timeline, it just doesn't happen that way. And I'm not saying don't ask your kids questions. Of course, ask them questions. You want them to know that you're thinking about what they might be going through. But a lot of those moments happen in the unstructured time and the random moments when you're just on a car trip, or you're driving somewhere, or you're sitting in traffic, and your child might see something and it reminds them of something that happens, and all of a sudden they're talking about something that happened in school 2 weeks ago, and you're thinking to yourself, why didn't you tell me about that? But don't say that, let it roll. So it's really about those unstructured moments when they open up that you don't want to shut them down. You don't want to say, well, we'll come back to that. I've had moments with my own kids where I've pulled over, and again, adults are guilty of it too. If your child has a moment where they're starting to talk to you about something and you're on your phone, that shuts them down also. So everybody has to kind of be mindful of, ways of interacting without the phones and talking and taking advantage of those moments that pop up.
That's so true. When you talk about the fact it's not just kids that, abuse social media and maybe are a little disrespectful in how they use their time when they're with others. I've been in a meeting where you're having a conversation on a topic, and then someone's sitting there and they're looking down at their phone and they're texting, and I'm like, you want to say, excuse me, let's all just put our phones down and let's pay attention to the subject at hand. And, it's really, really tough. As I said earlier, there are so many benefits to social media, but it's caused this whole different level of angst in many, many ways.
Yes.
David, tell me, right now you said there's a lot more women and young people coming in. Typically, what happens during a stay there?
So with the women, what will end up happening is that somebody will come in who's just finishing up like a hospital stay or some type of acute stabilization, right? So what will happen is they'll be in the hospital because they've had some type of issue or outburst or spike in their mental health symptoms. They could even be off a suicide attempt, and then what will end up happening is the hospital will do a wonderful job stabilizing them, get them on the medication, or just give them resources and intense services in the moment. And then what
That's
Outreach
you.
provides,
That's
what they do.
Catherine.
Exactly.
That's what they see me.
So then what Outreach does is that we provide rehabilitation as well as reintegration services for men and women who are adults that help them, learn life skills, learn healthy coping skills, learn them how to deal with, a lot of them are using substances, alcohol, illegal drugs, marijuana, so on and so forth, and where they need to learn to manage that, right? Mental health is stabilized, but the drug use is not. So we help them with those pieces. And that's a big key. And again, so we have the two phases. One is rehabilitation, which is kind of like a teaching phase, where we're teaching them all the skills they need to do. And then we do the reintegration phase, where they go back out into society, live a life in the community, but,
And give them that opportunity
Right.
to still connect
Yep.
with you, that lifeline,
Yep.
if you will.
Yeah, and stay with us.
Yeah.
And then for the kids, we provide residential services where we're doing everything under the sun. Pediatric care, we're doing mental health care, we're providing the schooling on site, we're doing everything for them. Because the kids, a lot of times what'll happen is that, and Catherine talked about it, like they see a lot of people in the hospital, right? But young people, if we don't remove them from their environment for a short period of time, they really don't ever stabilize. They just kind of go right back into it
Yeah.
and that immersed world that they live in. So much stimulus, so much things facing them. So what we find is that whether it's substance use, mental health, or both, we find that if someone is struggling with their mental health or substance use, to have them come into a short residential placement where their families are very much involved, because like there's a stigma, right, in residential adolescent care where like they don't see their families. They see their families every week. There's family counseling, group family counseling, individual. They go on visits at home. It's very, very important to have the
Right.
family
The whole
involved.
dynamic
Yeah,
is true.
absolutely.
Yeah.
But
Well, you said the word stigma, and I'm sorry to interrupt, but
No.
I want to hopefully get out of this today the fact that mental health is like, if you have a backache, you don't ignore it. If
Correct.
you have a stomach ache, you don't ignore it.
Yep.
Whatever, your knee's bothering you, go have somebody check it and find out you had arthritis, whatever the issue is. But there shouldn't be a stigma.
Yep.
Mental health is all part of our entire psyche, and there are times that you're going to be a little challenged and you're going to have an issue, and there's nothing wrong with getting help. And that's where professionals like Catherine and David come in. And I'm hoping that, we've done that here today. The fact that, they're able to come back to you or stay connected with you, to be that lifeline going forward.
the town has a plethora of services for adults, adolescents, through hospital, through rehab, through outpatient services, and, hopefully that people reach out on the website and take a look. And, because I do think that the resources are there. We just need people to access them. I know it's difficult to ask for help, but, please do. And places like Outreach and Good Samaritan and so on and so forth will be there
Yeah.
for anyone who needs it.
And I think the fact that the services are there, those that, the loved ones, there's where you can really intervene and really guide them. Maybe you're going to have to make the phone call. Maybe you're going to have to set up the appointment. But encourage them to get the help because you care, I used to say to my kids when they were growing up and, had to discipline them for something, I always said, that's the price you pay when somebody loves you. That they care about you and, care enough to direct you and help you when you need it, even if you don't realize it yourself. So I just want to thank you both for being here today. Again, it's a big issue. Don't want to keep harping on COVID, but, it's a reality.
It is.
And, some of the negatives that we've had to endure because of it, I think there are some positives. And focusing on the issue of the importance of mental health, I think is something that we might not have done had it not been for what we endured with COVID.
Okay.
So, David, thank you so much.
Thank you.
You and everyone, your team at Outreach do a wonderful job. And certainly Catherine, Good Samaritan Hospital is no stranger to us in the town of Islip. You
Right.
guys do a great job. And
Thank
just
you.
urge everyone to go to the website, islipny.gov, or to Outreach, or to Good Sam, or any of the plethora of agencies and institutions that are out there to offer that help, that mental health, to keep us, totally healthy as a whole person. So I thank you for joining us on Supervisor Spotlight.